Good morning, members of the board and executive leadership team. My name is Kalia McShann, and I have been challenged with creating a healthcare facility that addresses endemic healthcare disparities in Cook County, Illinois. Cook County, Illinois has 5 million residents according to the United States Census Bureau. I have chosen to take on the challenge of chronic obesity. Chronic obesity is a healthcare disparity affecting families in Cook County, Illinois. This disease has no respect of persons. It affects infants, children, adults, and the elderly. Obesity is a complex disease involving having too much body fat. It is a medical problem that increases the risk of developing other health-related diseases like heart attack, stroke, cancer, and diabetes, just to name a few. Obesity rates continue to climb, and now 4 in 10 adults are obese. In Cook County, Illinois, 50% of Blacks, 46% of Hispanics, 41% of whites, and 16% of Asians are obese. This is almost half of Cook County's population. My goal is to provide a comprehensive weight management clinic that addresses the economic disparities chronic obesity has on families in Cook County, Illinois. Addressing this chronic disease will help our healthcare organization mitigate other obesity-related illnesses like heart disease, stroke, hypertension, and diabetes. Using the SMART assessment tool, I have set clear objectives for the purpose of the clinic. S is for specific. Our objective is to create a straightforward, affordable approach to effective, practical, and healthy weight management for the Cook County patient population. M is for measure. Our program will measure the success of the program by tracking individual personal progress with monthly check-ins over the course of 1 year. A is for achievable. The program will be challenging yet achievable. We will set realistic goals and incentives to empower patients. R is for relevant. The program will be customized and relevant to each patient's care plan. T is for time-based. Our program will be designed to meet target weight goals within 1 year. Description of the program and facility. Due to the large population affected by chronic obesity, I have created a multi-dimensional program that addresses obesity from a mental, emotional, psychological, and physical vantage point. We will need the help from a multidisciplinary medical team to create individualized care plans to fit each patient. The facility will have 12 exam rooms, 4 surgical procedure rooms, 6 recovery bays for outpatient procedures, a lab for specimen collections and processing, and a state-of-the-art gym to help support patients' weight loss goals, and a waiting room that seats 40 people at a time. Our healthcare organization is located in a marginalized community. Marginalized communities are a group of people who face social, economic, and political disadvantages due to factors such as race, ethnicity, gender, sexual orientation, disability, or economic status. These individuals often experience barriers to accessing resources, opportunities, and fair treatment in society. We are committed to addressing inequality, and fostering inclusion is imperative to ensuring patients have a fair chance to access medical care. We are allowing families that fit the criteria to apply to the program regardless of their ability to pay. This would give our organization the opportunity to help families apply for public medical assistance through state and local government agencies. We are going to need the support from our stakeholders and private donors to help fund our program. Staffing and support. We would need to employ 42 staff members for the daily operational practices. This includes 4 physicians, 2 bariatric endoscopists, 2 primary care physicians, 2 psychologists, 2 nurse practitioners, 6 RNs, 6 medical assistants, 2 research coordinators, 2 medical coordinators, 2 dietitians, 1 administrative assistant, 1 unit director, 1 assistant unit director, 4 human resource specialists, 3 social workers, 4 environmental service workers to keep the organization clean. We also perform a SWOT analysis. Our internal strengths are WRSH's ability to provide advanced treatment in state-of-the-art facilities because of world-renowned medical experts and key clinical talent. Our organization has a reputation that precedes itself, which allows for practice buy-ins and support from private donors and community partnerships. Our ability to execute care safely while providing excellent healthcare outcomes has given our organization the edge needed to catapult innovative healthcare services to the community. Our weakness would include the ability to retain key talent in times of challenging times like COVID-19. We lost a lot of key staff to travel assignments because of competitive pay and compensations. Our organization spent millions to retain key staff and experts due to the inability to meet salary demands. External opportunities. Our organization can now streamline a much needed service to the Cook County area. The obesity program will help mitigate healthcare disparities and bring much needed healing to the patient population and community we serve. If the program is successful, other hospitals in the medical district can implement our process and help us eradicate obesity and heal the communities by lowering the rate of premature deaths due to chronic obesity diseases. The threats. The threats we face are other organizations with the same convictions creating programs like ours and extending them first, and taking our patient population and actually streamlining our services. Our policies and procedures and incentives. Our new obesity clinic will create policies that support the mission, vision, and core value of our healthcare system. Our policies will mirror WRSH operational policies for its clinics, which includes our commitment to treating and caring for all patients from diverse backgrounds without discrimination or race, ethnicity, economic status, gender, and sexual orientation. Our healthcare system provides procedures that will also mirror its operational process for existing clinics, and will include our new implementation of the value-based care system that states WRSH must deliver safe, quality care with excellent health care outcomes and excellent patient satisfaction with a low cost per capita. WRSH will commit to its code of conduct for the entire health system and will hold its employees accountable as well. Our incentives would include employee recognitions and competitive pay and compensation that shows employees we value them and that we're here to support their efforts. Program finances. Our estimated total salaries is $4,297,734. Fringe benefit expenses are $1,074,433.50. Our direct costs is $25,795. Indirect cost is $2,148,867. Equipment cost is $389,530, and it depreciates each year at $77,906. Cook County RVU reimbursements is 4.96. GCI is 4.032 with a total of 8.992 RVUs. This means the estimated cost of one visit is $179.90 for Cook County. And the adjustment for variable costs of treating each patient is $161.91. To break even, our clinic would need to see 46,451 patients per year, which means we need to see about 185 patients per day. This is achievable, and our new clinic will help our healthcare organizations transform how healthcare is delivered in the Cook County areas to families. Our organizational structure, because we are coming under Rush University Medical System, we're not changing the organizational structure, but we're creating a structure for the clinic. So our clinic will compose of a medical director and an executive director. The medical director will be in charge of overseeing the clinic's operation with the help of the executive director. So their role is to ensure Rush Weight Management Clinics follows Rush's mission, vision, and core values. We will have a unit director that will manage the daily operational practices and report to the medical director. Our physicians will play a major role in the leadership process because they will be the ones that will create the programs that specialize individual practices for each patient. Also, with the support staff from our nurses, psychologists, clinical coordinators, and research coordinators. We also created a SBAR, with the situation being that our healthcare organization is in the heart of Cook County, Illinois. The hospital resides in a marginalized community with several economic disparities impacting the families in Cook County. We have over 5 million residents, and it is ranked number 3 out of 104 counties in Illinois with the highest number of deaths from obesity-related illnesses. The background: the families in Cook County marginalized communities suffer from the lack of resources, education, social, and economic resources. This has a direct effect on their quality of health care and ultimately affects the community. Our assessment. There are so many improvements that would result from our organization's investment in weight management clinics for Cook County marginalized communities. If we invest in the program that addresses chronic obesity, we will inadvertently address other healthcare disparities like heart disease, hypertension, stroke, diabetes, and other obesity-related diseases, creating a healthier culture and decrease the number of premature deaths from obesity-related diseases. This investment will be a win for the community and a win for our healthcare organization. Our recommendations. I believe we need to create a multi-dimensional weight management program that addresses obesity from a mental, emotional, psychological, and physical vantage point. There are so many reasons patients fall into obesity, and it varies with each patient. We need the support from a multidisciplinary medical team to create individualized medical weight management programs to ensure the success of each patient. I believe we can fund our efforts through 3 financial strategies, one being donor support. Rush has a reputation for its advanced, innovative healthcare treatments, and our ability our ability for such advancement comes from the support of donors. The second financial strategy is community dinners, such as galas, black tie balls. All of the proceeds will be used to fund our weight management clinics. The third strategy will be to apply for community development block grants. We have already received several development block grants for solving economic issues in the community, and this would just add to our endeavor of providing excellent patient care and transforming how health care is delivered to diverse communities in Cook County. So please join me, and I hope that you will support our commitment to helping mitigate chronic obesity in Cook County. Thank you.